guys, how are you? I hope you are doing good. I hope everything is going great for you as you start the new week. And I hope you enjoyed your week if you were off on the weekend. And if you're working on the weekend, I hope you're starting to enjoy your day tomorrow. I am coming here with another video. This one is about gaslighting, but especially gaslighting in the medical field. This is so common in the medical field. And I'll break it down for you guys. I think the simplest way I could put gaslighting is when your healthcare concerns are being dismissed or being minimized. That's the best way I can put gaslighting. This happens all the time. You hear it in the news. It happens in people's offices. It probably happens to you when you go to present your case to somebody and they're making you think like it's in your head. But yet you know your body, and so you know what's happening to you, but somebody else tries to minimize what you're feeling or minimize what you're feeling based on their prior experience too. Case in point was a case last year, 2022, I think it was late last year, where a patient went to her OBGYN, and while she was at the OBGYN, she had gone in because her back was killing her, severely killing her in pain, and she saw this nurse practitioner who tried to tell her that she had 3 babies, and when she was pregnant with her 3 babies, she worked all the way until she delivered them. And she couldn't understand why the lady needed a note. And my questioning is, you're not the patient. You're not experiencing what the patient is experiencing. Why are you trying to minimize her symptoms? And she went ahead to tell her, I checked your cervix. I think you're doing okay. I think. You're not the patient, but you're telling the patient you think, and telling her that you had 3 babies, you worked up until the last minute. It's good for you, but that's not what your patient is feeling. Her back is killing her. She's coming to ask for this note, and you're trying to tell her you worked all the way. Good for you. That was you. But can you listen to the patient that you're taking care of? If you're taking care of patients in a biased way like that and not listening to them, it kind of skews your care, you know? And this lady was able to put it on video. I questioned that if it wasn't on video, if she had said it, probably nobody would believe that she had actually been treated like that, but she was actually treated like that. Gaslighting happens to minorities. Minorities being women. Women, you are in the minority group. Latinas, Black people, happens to you all the time, all the time. Case in point, you go say, these are your symptoms, this is how you're feeling. And the person may be listening, but at the end of it just kind of dismisses what you're feeling. It's good to advocate for yourself. If you feel like you're going to go to the doctor's office, if it is your doctor and they have your history and they're compassionate about it, they'll listen. And other places you go, it could be your first time and they don't know you, they don't know your history or anything. You haven't developed a patient-provider relationship in this case. So they may not be understanding as your previous doctor would have been if you're changing. Sometimes people don't change insurance because they want to. The company changes. This year they were using United, next year they're using Kaiser. And so as much as you don't want, maybe your doctor doesn't take Kaiser, now you have to get a different doctor. And this usually happens to everybody. You can still get it with a established physician, provider, nurse practitioner, physician assistant, nurse. They are all providers, whoever they are that you see when you go into an office to say what brought you in here. But if that happens to you, my thing is, prior to going to the appointment, you could write down some notes. It can get overwhelming. The time is kind of limited for the providers, if I should say so. So write down what you're feeling, write it down. So when you get to the doctor's office, your doctor, if you see a doctor, if you see a physician assistant, if you see a surgeon, the whole healthcare field, whoever you see, write down your notes so that you can refer to something so that you don't forget and present your case or questions. Another option you could do is go in with somebody who can advocate for you. Go in with somebody who can say, no, she wasn't like this year, but this year she started having worsening abdominal pain, or case in point, whatever it is that's going on with you, so that at least they have a second person that can advocate and say, no, it's not in her head. I have experienced her in the past year and this year, totally different symptoms, and this year I feel like her pain is worsening. So that's another way you can do it to save yourself time and to also have somebody advocate for you. Um, the beauty about somebody advocating for you is then on the healthcare side, so we avoid a disaster. Case in point is I have a friend, she gets pulmonary edema every time she has babies. Never knew, had the first baby, went home, and she felt like she was drowning. Her lungs were filling up with fluid, didn't know what was going on, called back the OBGYN. Luckily for her, the OBGYN said, if it gets worse, go to the emergency room. And she actually followed the rules because it got worse, and she went to the emergency room. And as soon as she got to the emergency room, she passed out. So they admitted her, and now, because she's educated about it, every time she has a baby, even if they tell her, oh, the insurance is not going to cover this extra days, because if you're healthy, really, you go home in 3 to 5 days. Sometimes they'll tell you the insurance doesn't cover it, so after you have the baby, go home. She has been able to advocate for herself and say, I don't go home after I have babies. We discharge the baby. I remain. I know I may pay a little bit more because my insurance won't cover the extra days. But in my case, this is what happens. Every time I have a baby, I fill up with fluid a few days after delivery and not immediately after delivery. So when this happens, she stays in the hospital. They do give her medication that helps her pee, and that way the fluid is taken off of her body before she goes home. So it has happened to her before, but she's also informed about it. She's done research about it, and she knows to tell the doctors that this is what is happening to her. And so they can discharge the baby, but they won't discharge her because she knows. When you don't advocate for yourself, they may send you home, and the outcome would be disastrous to your health. I tell people, if you feel you're feeling something and somebody's trying to dismiss you, look for another provider, change providers. Because if it's a simple case, that's okay, you can get away with it. Sometimes it's a bigger case that could land your health into a dilemma to where you could have avoided it if you just had a compassionate person to listen to you. And there are a lot of compassionate providers out there. So if you stick to one that's not listening to you, you may assume that everybody is like that. No. There are a lot of wonderful people that will listen to you, take care of you, and actually follow up on what it is you're saying. There was a case again. I keep coming again. When I was doing my research, I was like, oh my God, there's a lot of cases on this. Having your healthcare concerns minimized can lead to serious life or death experience. This lady kept saying she had swelling in her knee. Of course, this was dismissed, the gaslighting. I have swelling in my knee. It's not going away. It's not going away. Nobody listened to her. By the time she changed doctors to go to another doctor who said, oh, let's image this knee and see why has it been swollen for 2 years. It was a tumor in the knee. That is why it's important. You know your body. The doctor, the nurse practitioner, the physician assistant, qualified in whatever it is they do, but they are not qualified in your body the way you are. You know how you're feeling. You know how the symptoms make you feel. So speak up. Speak up. If your speaking up is not being listened to, just switch. Get another provider. You're not stuck to these people. You're not a tree. Move. Get somebody else who will listen to you so that you don't get into a medical emergency just because somebody dismissed what you were saying. This happens in every area of our lives, friendships, work, everywhere. You get people who can gaslight you. But medically, it can lead to a serious disaster. That is why it's important to speak up. How do you spot it? Most cases, it's happening to you. It's so subtle, most people are not able to discern it. But if you're sure this is happening in your body and you're trying to explain to somebody and they're not listening to you, that should ring a bell in your head and say, don't question yourself and say, am I feeling what I'm feeling because somebody else does not agree with you? No, don't question yourself. You know your body. You know the symptoms you're feeling. If they're dismissive of you, just look for somebody who can listen, especially in healthcare. And you have a lot of people who will listen to you. They will acknowledge what you're going through and help you so that you don't end up in a disaster, Many things come up, but patient is the ultimate. If you get somebody who listens to you, someone else will tell you, oh, no, it's not what you think it is. They haven't tested you. They haven't done any blood work or anything, but they're dismissing you outright. No. Know your body, know yourself so that your concerns Get somebody who validates your concerns, because this happens all the time. It's all in your head. This is normal for your age. Oh, I'm sure it's not that. It's just a little bit of swelling. The lady who was told it's a little bit of swelling ended up being a tumor of her knee. That was the little bit of swelling. So advocate for yourself. If you're thinking, I can't advocate for myself, or scared, or then take somebody with you. Take somebody with you, be it in the hospital. It can be an overwhelming experience, especially if you don't know what you're going through. It's overwhelming, it's scary. Take somebody with you, a sister, a spouse, a friend, or somebody in healthcare who can avail themselves for you to advocate for you what it is you're feeling to the provider that you're seeing. You can jot down notes during the appointment too that can help you follow up on the things you didn't understand, because the time is short. That is, honestly speaking, most of them don't have a lot of time unless you've gone to a specialized surgeon like a cardiologist. Those people have more time. Neurologist, nephrologist, their time is more extended than in a primary care office. So jot down if you have questions. Usually you always have a follow-up appointment. During the follow-up appointment, ask them what you forgot to ask, or what you didn't understand the first time that you came in, or whatever, when the concern arose when you came in. So it can be helpful to find and stick with a primary care physician that understands you, that you trust. That is more helpful for you, because then you can, when you let your needs known, it's not a question of minimizing your experience. They actually are compassionate and will listen to you. Most people are stuck with I remember telling one doctor I was seeing at a time that my knee was aching. At the time, it was too much hiking, I think is what I was doing. And she said, oh, it will be okay. But this was not an acute. It was not an acute. It was not a short-term 3 months or less thing that I'd been having. It was more than, I'd had it for more than a year. And she just dismissed me. She said, oh, yeah, you know, that's normal and this. Oh, I didn't have no follow-up appointment with her. She must have looked. They called me and tried to set up follow-up appointments with me. And that was it for me. I was like, no. If you didn't listen to me the first time, this is, knee, probably nothing was wrong. I knew that it was too much hiking at the time. But the fact that she dismissed it so fast, I was like, oh, no, you're not the kind of person I want to be seeing as a doctor. Absolutely not. So I left. I didn't give them warning. I just left. They kept calling me for follow-up appointments. Never followed up with them. So take care of yourselves. Advocate for yourselves. And as subtle as the gaslighting is, have the discernment to know when somebody is actually listening to you or just brushing you off. If they brush you off, you have consistent symptoms, they keep coming and nobody's addressing them, change providers, go with somebody, seek a second opinion, or find somebody who listens to you. I wish you guys a great week and take care of yourself. Self-care. Sleep well, take care of yourself, and we'll see you in the next video. Bye-bye.